My name is David Rhodes, and my hometown is America. I grew up in a military family, and so during that time I got to live all over this country and around the world even. I graduated from UNMC for medical school, and then after that transitioned to the University of Utah for my orthopedic surgery residency. When I finished there, I went to Canada for a year and did a fellowship in upper extremity reconstruction and sports medicine, and then went to Kansas and practiced general orthopedic surgery for 3 years. During that time, I had an opportunity to go on a medical missions trip to Africa, and that experience really sparked in me a desire to pursue further education in hand surgery. And so when I got back, I started working towards that and was able to obtain a fellowship in hand surgery at the University of Arizona, Phoenix. And then subsequent to that, I also completed a pediatric hand and upper extremity fellowship at the Shriners Hospital for Children in Philadelphia. I chose hand surgery as my specialty because I truly enjoy getting to help patients throughout their entire life, from infancy to their later years and everything in between. As an example, when I get to meet a family and a young patient that has maybe a birth injury or is born with a congenital hand difference, that's very gratifying to me because I know I'm going to get to spend many months and many times years with that family and that patient, getting to know them and help them with the issues that they're working through. I think a great place to start when you're meeting a patient or family for the first time is to listen. To really take the time to be quiet and hear what they have to say. They come to meet me with goals in mind for what they're hoping to accomplish, and so it's an opportunity to hear what they're saying, what their goals are, and then to come alongside of them and together work on a plan to help them meet their goals. In my adult hand practice, I treat a variety of conditions, including degenerative conditions or arthritic joints, compressive neuropathies like carpal tunnel, cubital tunnel, and of course traumatic injuries to the upper extremity. As an example, one thing I really like is doing tendon transfers and nerve transfers for patients that have sustained an injury and helping them regain their function. In my pediatric hand practice, I focus on patients that have congenital hand differences, brachial plexus birth palsy, arthrogryposis, tetraplegia, and of course traumatic injuries in sports medicine. One of the things I really like about working for Nebraska Medicine is the vitality of being a part of a leading edge academic center. You know, patients come to this campus with serious problems and they're looking for help, and we get the privilege as physicians to come alongside them and help them by providing extraordinary care.